Hey downtown van.
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 You're listening to Hey Downtown Van, hosted by the Downtown Vancouver BIA.
Hey Downtown Van, welcome back to another episode of the podcast. I'm your host, Sofia Laratta, and today's guest I'm very excited about, Deb Lester, the CEO of Covenant House Vancouver. Deb brings over 30 years of global experience in health and social services. She's a former nurse and senior leader with the Canadian Red Cross and is dedicated to supporting vulnerable youth with compassion and vision. It was a very important conversation to have, and I really think you'll enjoy this episode. So let's get into it. Deb, thank you so much for joining us.
I am so happy to be here.
Yes, we've been trying to get you on the podcast for a while, so we're really happy that you're here.
Me too. I've been looking forward to this, and I think today's the right day to have this conversation.
Yes, absolutely. So for those listeners that maybe don't know what Covenant House Vancouver is or Covenant House in general, do you mind just giving us a brief overview about what you do and what the mission is in the community?
Absolutely. So let me start off by just saying that Covenant House is part of an international federation. So Covenant House International, there's 35 sites around the world in the North Americas and in Latin America. 2 in Canada are the 2 largest sites. And we are all independent sites, but we really work together towards a unified voice in Vancouver. So the federation's been in existence for 50 years.
Wow.
And Vancouver, it was 1997, we opened our doors. We're 28 years old. Unbelievably, heading into our 30-year anniversary here in Vancouver. And what many people don't know is we're more than a shelter. We serve young people who are at risk, so at risk of homelessness, who are dealing with mental health and substance use and different, I think, components that have brought them to our doors. 16 to 24, we have a full continuum of services. So right from our drop-in and our outreach program all the way through to transition to independent living. And we have what we call a one-size-fits-one approach. So when a young person comes to our doors, we really talk to them about their goals and really what brought them to Covenant House so we can work and find maybe the best program to meet their needs. Any young person who comes to Covenant House, they have access to what we call our wraparound services. And so that's anywhere from, anything from art therapy to our food services. We have a music room, and we have a big gym and a fitness center and lots of different educational programs throughout the community and also at Covenant House. And that's really important because we really look at what we call the social determinants of health. So what makes a healthy person? And we look at all those social pieces that come into it in addition to, their mental health. And mental health supports are at the core of all we do. So any of the programs that young people will be accessing, they will receive mental health support. So we have a multidisciplinary team that's there, again, to kind of help them to work on their goals, whatever that might be.
Wow, that's beautiful. Is Covenant House a nonprofit organization?
It is, yeah. We're a nonprofit organization. And as I said, each site is independent. So in terms of the federation, we have been predominantly privately funded, which is really quite remarkable. So when you think about there was a decade-long dream of building 3 beautiful sites here in Vancouver. And that was all supported by the community.
Wow.
So I always say that's the power of when a community unites in a mission.
Yeah.
It's a real testament to what can be done. And our buildings, we have 3 of them in Vancouver, so 2 at Seymour and Drake and 1 on Pender. We just completed this capital expansion in November of 24.
Wow.
And the spaces were really built, there was intention behind the building. So they're trauma informed, our young people informed, what they would like to see in terms of places and spaces.
Wow.
And the buildings really send a message to them that you're worth it. So it wouldn't be what you would maybe imagine a typical shelter to look like, but very, very, every single program, every area that youth access in our buildings have been built with lots of love and lots of intention.
Yeah, I walk by the ones on Seymour and Drake quite often. I live nearby, and you're right. It doesn't look like what you would think it would look like. It's a very beautiful, well-kept buildings.
Yeah, they're really beautiful. And we did that on purpose. We wanted to raise the bar for what youth services should look like. And again, as I say, we want to send a strong message to those young people that are in our buildings and programs that they are worth it.
Yeah, absolutely. So what inspired you to get involved with Covenant House, and what led you to become the president and CEO?
Well, I'm Canadian and left BC in 1989. And I was on I told my parents I'd be back in 6 months, and I returned back to Canada 30 years later.
Wow.
So I was working in international development and strengthening health and social systems around the world. And it really changed my philosophy. The care and support of young people have always been at the heart of the work that I've done. And when I returned home, I'd been back a lot on vacations and that my family's here. But when I came back, it was with I would say the mission to really want to affect change in Canada, so in my country. And I was really astounded with the severity and the gravity of what I could see our young people are facing here. Looking at young people who are living on the streets, who are homeless, who are dealing with mental health and substance use. In issues around that. I come from a public health background. And so when I was introduced to Covenant House, I was really moved by that continuum, because I think when you're feeling, helpless and hopeless, to have all programming under one umbrella is incredibly important. It's very hard to navigate a system when you're feeling that way. And so for Covenant House to be able to offer that to young people, to me, was sort of the secret sauce in really helping them to, reimagine what their dreams are and to help them on that journey back to health and well-being. So I was just smitten the minute I learned about Covenant House, and just had the great honor of joining the team a couple of years ago.
Yeah, that's amazing. Congratulations.
Thank you.
And I'm just curious, and if you don't have this number, it's totally fine, but does Vancouver have a high percentage of unhoused youth compared to other cities in Canada?
We do. So we have about 500 to 1,000 on the streets on any given night. And we tend to look at that higher number, so about 1,000 young people. We did the point in time, the count that's done in Vancouver and kind of the surrounding areas. That's really just a snapshot in time. And we know that homelessness has increased since the count's being done now, but when the count was done a couple of years ago, the homelessness in general has increased by about 30%.
Wow.
So the highest increase since the count began, and young people are a good percentage of that. And so we think that number of 1,000 per night is accurate. And so we have, as I said, we've got our drop-in and our outreach. So we really want to bring young people off the street. So for the drop-in center, they can come during the day, they can get access to food, they can have a shower, wash their clothes. There's a community there to support them. Our team is there to support them. And it's really also part of introducing them to the other programs that we have. So we might have up to 100 young people a day that access our services that are open from early in the morning in the drop-in space to later in the night. And then we have spaces where they can stay overnight as well.
And the housing building, that's the one on Pender?
So we have our young people in all of our buildings.
Oh, okay.
So Seymour and Drake and in Pender. So if I could talk a little bit about the programs, if that's helpful. So the drop-in and outreach is on Seymour and Drake. And in the same building, we have what's called the Sanctuary program. And that's a new program for us. It was on our wish list for many years and kind of a completion of our continuum. And that's what we call a low barrier program. So that's where young people might not be ready for our more concentrated or case managed programs where they're really working on different goals. This is really to get young people off the streets and to get them safe. So they'll have a roof over their heads. They'll have a team that will be there to support them. These could be young people that are often, are all using substances and maybe have been on the streets for some time. So just coming inside for the night is a really big adjustment. And so those are the beginning parts of our continuum. And then in the other the building across the street, we have the Foundations program. And that program is for young people who are working on their substances. So that is a number one goal for them. And we do the Sanctuary and the Foundations program in partnership with Vancouver Coastal Health and the Ministry of Health.
Cool.
And then in that building where foundations is, we have the crisis program. And that's been a key program of Covenant House in our sites all over the world for many decades.
Mm-hmm.
And that's really where we have a multidisciplinary team, and we come in and we call what's case management. So we can really work with young people and say, okay, what are your goals? What is it you want to work on? And we can really kind of get to work on that and provide them the best supports around that.
Mm-hmm.
And then on Pender is our Rites of Passage program. And that's a 44-bed program. And that's for young people who are really getting ready to transition to independent living. So those rooms are more, they're like little studio suites or dorm rooms. We have teaching kitchens in the building.
Wow.
We have a beautiful, patio, outdoor gardens, a rooftop garden. And they're really learning those life skills to get ready to, transition out of our programs. So it doesn't mean you have to go through the whole continuum of care, and some young people do, but we try and match them, in terms of where, again, what are their needs, what are their goals, and what's the best fit. So each of the buildings has different programs within them.
Okay.
And so not only are there the overnight programs, so many, I think we're at about 140 overnight beds, but then there's also all the day programs and all the activities that go on.
That's really cool.
Yeah.
I think it's so important to have that program that helps young people transition into independent living.
Yes.
Because I feel like a lot of the time they'll go through the programs, they'll finish it, then they're just unable to live on their own, and it's the same cycle all the time.
Exactly. So you think about, I always call it a cliff in some ways, because you think about, our affordability crisis, our housing crisis, we have a toxic drug crisis, and the intersectionality of all of that, and whatever also brought them to Covenant House. We have a high, percentage of LGBTQ, young people who identify, and so, what supports can we offer in terms of making sure that transition from the services and all the work that they've done over the time that they've been with us to give them the best, bridge to success. So, and whatever, we hear about dreams a lot. So we hear about, that when they were young, the dreams that they had for their future. And often as they are an adolescent or a young adult, and maybe things are becoming unstable in their lives, and those dreams begin to be shaky or start to diminish. And they usually say once they've arrived on our doorstep that their dreams are completely, they're gone. And so what we want to do is really help them to re-envision, maybe they, the old dreams resurface, but there's always some new dreams as well. And then throughout their journey with us, how do we help them to realize that and actually be able to live out their dreams as well? So,
wow, that's very special. Could you please share a story or two that highlights the impact that Covenant House has had on the lives of young people in Vancouver?
Absolutely. So I'll tell a story about Alex that we talk about. And I've had the great honor, I'll say always, with any of the young people that I spend time with. He thought he was going to stay with us for one night. So Alex had a situation in his family that they had a breakdown, and he recognized that he was on the riding the SkyTrain at night and had nowhere to go. And someone told him to come to Covenant House. So he thought, okay, I'll go for a night, and then I'll figure out, kind of what I want to do in the next night. And he had a realization that he was in fact homeless. He couldn't believe that he was in the situation that he was in. And Alex stayed for 3 years.
Wow.
So what Alex realized is that he had, again, there was different needs that he had or different goals that he wanted to work on. And sometimes I'll say it's almost like peeling back some of those layers to really get to the root of what some of the issues were that brought Alex to our doors. And now he's transitioned on from Covenant House. He's a leader in our community.
Wow.
He leads a team. He often will refer if we have other young people who are looking for employment, he'll hire them onto his team. So Alex is one incredible example of, all of the young people that access, the services at Covenant House. We have a young person who is in medical school, who is wanting to, become an MD. So I always tell people, your next GP could be a former homeless youth.
Yeah.
We have another really inspiring young woman who was trafficked as a young girl, and so came to Covenant House, and we really worked a lot on again, realizing, her dreams and the healing that she needed to do. And she is working to become a lawyer, and
Wow.
social justice is at the root of what she wants to work towards.
Mm-hmm.
So these are just a couple of, the stories of young people,
Mm-hmm.
but we really talk about resilience. We had a youth panel the other day that was speaking to our community that supports Covenant House, and resilience is really at the core of all of the young people that come to us. And often what they've been through is really, it's hard to hear.
Yeah.
And so we think about that path that they take towards that health and well-being, and they always inspire me.
Mm-hmm.
And always at the heart of that also is the community that they build around them in terms of either wanting to give back, or the community that they build at Covenant House.
Mm-hmm.
And that to me is, it's pretty remarkable.
Yes.
And I always, an investment in our young people is an investment in our community.
Mm-hmm.
They are our next generation.
Mm-hmm.
So it's really important in how we treat our young people, and how we as our community, and how we make sure that we offer all that they need in terms to recognize what their path is towards their dreams.
For sure. So can someone stay with Covenant House as long as they want then?
They can stay. So our so we have the 24 is what we call kind of our cutoff per se. So when we know that when a young person is, in terms of our overnight beds, and that they're maybe approaching their 24th birthday, or that 24th year, but it's never a cutoff completely from Covenant House or our programs.
Mm-hmm.
But really it's we back that right up, and we look at that transition on to whatever that next kind of bridge would be for them.
Mm-hmm.
And so the team is working on that much, before, the age of 24. But in terms of staying in our programs, when they're within that age mandate, they can stay as long as they need to make sure that, we can support them as long as long as they need, as long as we can. So.
That's great. That's so important.
It is.
What is if you have this number, so I'm asking you for so many stats.
That's okay.
Do you have like the number for success rates of people that exit Covenant House?
Yeah. So what we look at, we call them our program outcomes. So you look at, what is adherence to employment, or what is adherence to schooling, or what is, if they had a plan, so whatever their plan was, because they're all individual, how is the adherence to that plan? Like, were they able to really walk through their plan? So lots of different criteria like that in, indicators that we measure, and that's in the high 80s to like mid 90 percentiles. Wow. So when we measure kind of, what was their, able to maintain employment, or able to maintain or eradicate substances, they're all in those high percentiles. So it's really that, again, it's that support that and all the work that they do through all of the time that they're with us, when they're on the other side of that, and they're looking at as they're, leaving Covenant House. I think those are pretty powerful numbers in terms of, kind of, what they've achieved.
Yeah, that's huge.
Yeah.
What are some of the biggest challenges that the youth are facing in Vancouver today?
So I know we hear this on the news every night, every day. I feel that the mental health challenges and the substance use and homelessness, which all, often go together, are like we've never seen before. Wow. So our team, some have been there for a couple decades, and for many, many years working at at Covenant House Vancouver, have said that the mental health needs of young people are like the team, something that the team has never seen before. Wow. So the level of support that's needed, and that takes, a different type of approach. And because of our private funding, Covenant House has been able to be very agile. Because our community's been supporting us, we've been able to really respond to the changing community needs as well. But that's a big one. So for us, in terms of our programming, so we talk about that sanctuary program, maybe we wouldn't have needed that, 15 years ago, but we certainly need that now, because some of our other programs may not be ready for that. When we've got an intersection of an affordability crisis, we've got a toxic drug crisis, and a housing crisis. So when you put all those pieces together, and then the mental health piece on top of that, that's where they just feel they're young, they
Yeah.
feel overwhelmed by all of that.
Yeah.
So how can we help them to really, work through that?
Mm-hmm.
And it's the same when they're leaving Covenant House. When we look at the affordability crisis and the housing crisis, it's a challenge. Our
Yeah.
team works very hard to really try and look at placement for every young person when they're leaving Covenant House. So how can we make sure, and that's part of our new strategic plan, is how can we make sure that that bridge is really there? They've done all this hard work, with us. How can we really ensure lasting success for them, when they exit?
Yeah, I can't even imagine being a youth in that position. Like you say, the housing crisis, it's bad for people who are not struggling.
Right. Yes.
So it's just so important to have resources like Covenant House to help these
Absolutely.
people.
And mental health too, access to mental health services. I have a lot of families who call us. So their young people aren't homeless, but families are trying to figure out how to access mental health supports.
Yeah.
So we know that's why that's a core of all we do. And we try and be a good partner as we, to any of our community members who are seeking services, to really connect people, even if we don't have the services that might help somebody, to make sure we connect them into all of our different partnerships that we have as well.
Yeah, for sure. I feel like mental health has always been something generations ago and today.
Yeah.
Why do you think is it worse today, or is it just that we're all talking about it more?
I think all of the above. We think about this generation being the digital generation, and there's a lot of research that's coming out on that now. So as the digital age of phones and all that, for a lot of parents that, they were raising kids as the first generation of a lot of that access, there's a lot of theories around that. We knew after the, COVID pandemic, we really suspected there was a lot of isolation for young people at very critical parts in their development. So a lot of the, public health and the clinical experts really predicted that we were going to see, a mental health crisis. And then you think about family, you think about families, and again, all these different components that we talked about in our society around affordability and around all these different pieces layered on, and maybe our health system that's also been struggling. And so you have all the intersection of these pieces that could all compound that. But also, most importantly, as you said, is maybe we also weren't talking about it as much. And so a lot of what we want to do is really decrease stigma and educate about, mental health is health, that we should look at mental health like we would when we're treating, someone who's a diabetic or someone who has cancer, that we need to make sure all of the supports are there, and that we normalize it, and speaking about it and making sure that, when someone seeks access, that there isn't, stigma around that as well.
For sure. I feel like the stigma is getting better, but we're still
got some work to do.
Yes,
right? Yeah. I
sure.
agree with you. Yeah. Yeah.
What are some of the key sources of funding, and how do you ensure the sustainability of your programs?
That's a great question. So when I joined the organization, we are predominantly 98% privately funded. And I think that's incredible. I mean, I've worked with nonprofits all over the world. And when I saw that at Covenant House, I will say I was blown away. And that to me is a real testament to our community. So that talks about, our community that came together, united in the mission of what they wanted to see at Covenant House. And I think the buildings, that was a $65 million capital expansion that was supported, by many, many of our community members, many long-standing community members here and organizations in Vancouver. So I think that is a really telling story about the power of community. I really also wanted to make sure, and I've worked with ministries of health and different ministries all over the world, and it's really important. I wanted them to really understand the services that we have at Covenant House. And that's actually how Sanctuary Program came into fruition, was having the government come in and really seeing the programs and looking at how we as a partner could continue to evolve our work with the government to either help inform, different policy and programming that we're seeing, both provincially and also nationally as well. and just making sure around, and informing kind of, what we look at in terms of the future as well. So that partnership with government is also very important. So we're now almost 20% government funded as well. So we've
nice.
added that into, into kind of our funding streams. And we're always looking at the diversification of that as well, and looking at the future and what that's going to look like, and what, the potential growth of Covenant House would be as well. But I think that story is very compelling. When I walk through those buildings, and as I said, they're beautiful, and you have to come visit as well.
I would love to.
They're beautiful. And I think that really, I think that was a message that the community really sent to the young people that are utilizing our spaces.
Yes, definitely. And I say this all the time, but I feel like living around Covenant House in that area, you wouldn't even know what the services are for, because it's just quiet, well kept. Like it just blends in with the community. And it's such a great example for any sort of housing or resources for the unhoused population in Vancouver. I think it's a great model that we should adopt for everything.
I couldn't agree more. Yeah. I just think about, when we, the young people that are in our spaces, they're proud of the space that they're in. And I'll tell you, even when we opened the sanctuary program, the very first days that we opened, and different young people knew that they had a place to stay. So they had been, on the streets, sometimes for a while. Yeah. And they would come into their room, and we see this in all of our different programs, and they couldn't believe, like, this is the bed that I have, or is this the space I have? I can stay here. And even, at the very beginning days, as maybe some didn't feel that they were comfortable even sleeping in the bed, like it took a while, because they'd been used to being awake at night. Wow. Because when young people are on the streets at night, they're usually awake because they have to be, in terms of their risk for their own safety. So just if you think about the complexity of that and really coming down from that. And so if you think about those young people that are in our spaces are truly right off of, the streets of Vancouver and beyond. Yeah. And as you say, I mean, they deserve that space. They are our community members. And in terms of the community that they're in, there's, they're secure.
Definitely. So, it proves that it works when it's done right, and it's been taken care of.
Exactly. And I think that continuum, I keep kind of really hitting this one hard, in all my discussions with our community members, that continuum is really important, because I think that is really the secret sauce in many ways. Because when a young person, maybe they do start at the beginning of the continuum and they're moving their way through, they have the tenure with us, and the team really gets to know them, and the trust, is secure. And sometimes, trauma is what brings a lot of young people to us. We use a trauma-informed approach in everything we do, recognizing that everyone comes with the, traumas, and how do we make sure that we have that approach? So having that continuum, and I know others that do the same, I think that's a really important component of success for our young people.
Yeah, for sure. What are your long-term goals for Covenant House Vancouver, and what do you envision for the future?
So we're pretty excited because we have a new strategic vision, which we're calling the Journey Home. Nice. And we just had it. It's just been completed. It goes live in July, although we're actively working towards it now. And there's 3 core pillars of the plan. And we say prevention, intervention, and restoration. And intervention is the core pillar. That's the programs. That's the work that Covenant House has always done. That will always be at the center of everything that we do. And how do we continue to provide service excellence? How do we continue to be agile in a changing, landscape, as we were talking about? So that will always be, front and center of what Covenant House does. And what's unique about us, and then if you think about advocacy, so I'll move to the prevention pillar, is that we actually have young people who inform what we do. And I think that's a powerful piece for Covenant House, because that's all programs should be built and centered around the experiences of those that are accessing the services. So when young people tell us, well, what brought me here? This is what worked and this is what doesn't work. We learn from that. So that prevention pillar is going to be a big one for us. And that's about, how do we get upstream? How do we end youth homelessness? And that's our vision, is how are we going to end it? And we believe in thinking about 7 generations out. So we think it's an Indigenous philosophy. And we think about when you are faced, with this maybe overwhelming issue around homelessness, well, how do we start to put those building blocks in place so that we can affect change even, 7 generations sort of down the line?
Yeah.
And I've always said it's one, young person at a time. So when you are affecting, positively the life of one person, then we're on the right track. And so with youth homelessness and with our, with our vision to end that prevention pillar will be about advocacy. So bringing the youth voices to the public. It'll be about educating. It'll be about advocating for what we know works.
Yeah.
It'll be about hoping to affect policy around youth services. And decreasing stigma. So we're going to look at that from a provincial, a national, and an international lens. And so with Covenant House Toronto, so our other Canadian site, we'll be forming a partnership so that we'll speak nationally with one voice. And then, of course, provincially, we have all of our incredible partners, and we'll continue to be, working with all of them across many sectors. And then internationally, as a federation, we were talking about, I just got back from Geneva, so working
cool.
with the World Health Organization
Yeah.
around, and we always say, think global, act local. So we, our government is there, governments from around the world. How do we all come together around what we think, from an international perspective, and then bring that back to our communities? So we're going to be very active on that prevention pillar.
Yeah.
And then the other is restoration. And that's about what happens, as I was speaking about, when young people leave Covenant House. So how can we ensure that that bridge is really as smooth as can be? And so that once young people are exiting, that we have, maybe housing that's stable, that we can make sure that's affordable, that they can access, and make sure that we can really connect them in with all of the services after they leave, to make sure, again, that their dreams, all of the work that they've done, that they will be able to realize all of that as they exit.
Wow. That's
our
amazing.
new plan. Yeah.
That's a great plan. It's a very important plan and goal to have to end youth homelessness. Is the plan available for people if they want to go look at it on your website?
It's just getting loaded now, so
wow.
Stay tuned. So it should be up anytime. We're very excited about it. So, and I'll be talking with a lot of our community members about the plan. I plan on meeting with there's many organizations that support us, and of course our supporters, but really talking about that. And you'll really hear us talking a lot about the different issues that we're talking about today that bring young people to us and bringing their voices to the public as well.
Yes.
So I would say stay tuned, but the plan should be loaded quite soon.
Amazing.
So,
I can't wait. I'll read it myself for sure.
Thank you.
Of course. How does Covenant House engage in advocacy or policy work? So you're talking about prevention and advocacy and youth voices. What else are you doing on like the government policy side of things?
So we do a lot of work. So we were recently, the last few years, working on what we call the SAGE legislation. So that's when our, young people are exiting care, or, so if they've been in foster systems and there's that sort of cutoff. How can we work with the government around policy to make sure that many of the supports that young people need are still in place for as long as they need to access that? We're on many roundtables around the province and also nationally as well. So I just recently, last week, was with a group around, talking about housing and kind of really brainstorming around that, or with BC Housing and our great partners at BC Housing. So there's many, many different roundtables that we go to really bring the voices again of our experience and of what we know the needs are in the community. And we're continuing to seek those out. So it's really about what we call partnering for impact. So others in the sector, so whether it's organizations or other nonprofits, we are very actively involved and have been for some time, but we're always, increasing that involvement and looking for others as well.
Yeah.
So we're brought in by the government to talk about, different, policy or just informing whatever that might be, and also having them come to our sites as well. And as we're talking and we're learning, and that also does inform a lot as well. So I would say we have many irons in the fire around advocacy and policy and the different discussion groups and tables that Covenant House is at.
Awesome. What opportunities are available for those interested in volunteering or pursuing a career with Covenant House Vancouver?
That's a great question. Volunteerism is we heavily rely on our volunteers. So we really have a strong volunteer team, and there's so many different things that our volunteers do. So, a couple of our signature events that we do every year are sleep outs.
Yes.
So we have those twice a year, and we have in November and February. And that's really about, it's not about mimicking homelessness or pretending to be homeless, but it's really a community awareness event. It's about raising awareness and also sending the message to the young people when our community is sleeping out for one night that we see you, and we are here to advocate and to raise awareness and to stand for what, for your rights and for what, that we know that you're going through. And so we have many volunteers who help with that event or attend that event. So we have our supporters. We have lots of around the winter holiday season time, a lot of different events as well. We pack backpacks for young people, so the community comes together and they donate many of the essentials that are needed for young people, and they go into the backpacks and they're given as gifts to young people.
So nice.
We have endless opportunities, and on our website we do have a portal where interested volunteers can give us their contact information. Our team can connect with them and decide maybe what the best fit would be given the array of volunteer opportunities. But I would say, like all nonprofits, we heavily rely on volunteers, and we're so grateful too, because we've got many that have been coming day after day, week after week, year after year to support the work that we do. So lots of opportunity.
Amazing. I think we've had some staff at our office.
You
do
have.
The sleep out
you
before.
Absolutely have. Yes, absolutely. Yeah. And it's a powerful event. I mean, people, when you sleep out on the streets, and we've had different weather, obviously, and that, and even, it's one night, and we all have the gear, and we have the, we have all the prep time to be able to prepare for the event.
Yeah.
And even with all of that, usually the morning, after, because, our, sleepers haven't slept, and they realize, just a lot of maybe learnings that they hadn't been aware of. And there's a lot of emotion after the event as well. And that stays with a lot of our community supporters for quite some time. And that's really the essence of what the event is.
Totally.
Again, is to raise that awareness. So how do you, after you've not slept all night and you have that cold concrete, pulling your body heat out of your body, then go and, apply for employment or show up for an interview or to, go back to school when you're really just trying to stay awake and, and to try and find some food for the next day and that. So, there's a lot of, learnings through events such as that.
Yeah,
so.
Definitely. I can't even imagine. It's so true though, the not being able, you can't sleep.
Right. Yeah.
You're worried about your own safety. And that does affect you in the long run and every day. And
usually they have to, if they're awake all night protecting themselves, then they'll try and catch some sleep during the day, and it's a little bit warmer as well. And then so how, so it's just a vicious cycle that many, are in. And that's one of the, very harsh realities of, life on the streets.
Yeah.
So, and also trafficking as well. So we do a lot of work around the prevention of human trafficking. We created a toolkit around that, and we work with many sectors. We're one of the founding members on behalf of the Lieutenant Governor of, there's 12 founding members of sectors across Vancouver who have come together to really combat human trafficking. We do a lot of work on educating all across the sectors with our toolkit around what does trafficking look like, how does it happen, how can we prevent it, how can we recognize it. But we do have a lot of our young people who come to us who have sadly been trafficked. And when you're a young person on the streets, then being exploited too by traffickers, there's a lot of risk there as well.
I had to do some training for human trafficking when I worked in hospitality. So
it's so great to hear that it's like, in all of, because it crosses all sectors, so that awareness is really important for our community.
Definitely. What message would you like to share with our listeners about the importance of supporting youth in need and the work being done at Covenant House?
Well, whenever I go anywhere, and even some of these forums or these tables that we've talked about, I always hear, well, we have to affect change when they're young, when our
Mm-hmm.
community is young, and we know that most adults who are homeless, they do say it began in adolescence or young adulthood.
Mm-hmm.
So I really feel that this is also prevention. So what Covenant House does is we are looking to affect change for when our community are young and trying to really maybe change the tides of whatever it was that brought them to us or whatever they're going through. And that's a really, really I think that's an important message for our community to understand, and also that they're worth it. This is every young person that comes through our door, they are worth it.
Mm-hmm.
And we think about our own children or our, different family connections or through our friends or through our own community connections. Every young person deserves that chance.
Yeah.
And that investment in a young person is an investment in our community.
Mm-hmm.
So we always want our young people who are, at Covenant House to really know that they are worth it.
Mm-hmm.
And that is I think that's an important message in how we, you could become so numb when we're hearing about the issues every day to maybe what the solutions are, and to know that there is positive impact.
Mm-hmm.
There is impact. These young people are, working towards their dreams,
Mm-hmm.
and they are realizing their dreams, and that change is possible.
Mm-hmm.
But it does take us all coming together. It's complex, and it doesn't happen overnight. And there's not one solution, but there's an array of solutions and support.
Mm-hmm.
And we just, as a community, we need to be aware of that.
Mm-hmm.
And we as a community need to stand as we would for maybe our own young people that are in our lives, for all of our community members.
Yeah. And I think as Vancouverites, we can also be really insensitive when it comes to the unhoused population of all ages, because everyone's used to it, or it's just a part of our daily lives. But you really have to think, like, that could be my sister, or that could be my daughter or son, or, you have to.
It happens to, and it really, it touches many people. It touches, more people than we realize in different family. And so, if we can come together as, lock arms as a community and really create that, umbrella and that safety net for young people, I think we would see a lot of change in our community.
Yeah.
And we have to remember again, one young person at a time. If we can affect change in one young person's life, then we're on the right track.
It's very interesting also that you mentioned a lot of it stems from childhood. We had Guy Felicella on the podcast.
Yes.
He was like one of our first guests, but he mentioned that he had undiagnosed ADHD as a child, and that probably snowballed into a whole bunch of different things in his adult life. So you really have to take things seriously when they're growing.
Absolutely. And Guy is one of our most favorite people. We are with him all the time, and he brings the voice of that lived experience.
Yeah.
And again, the education that Guy has done is just, is outstanding, because he's telling the story, and the story that he's telling, his lived experience, is exactly, as I said, all of these stories that we hear from our young people. And of course, they're each unique, but there's a common thread around that, around supports, and around kind of, peeling back those layers and realizing what is at the root of what brought them to Covenant House. And Guy's, description of what he went through and around undiagnosed ADHD, and we think about undiagnosed mental health, or undiagnosed, all these pieces, and then potentially substances, help with when you're, with the numbing of that, or the self-medicating when you can't access services and you're young, you might not realize whatever this is. And so Guy bringing that lived experience and his voice to the community is so powerful.
Yes.
And we need to continue to do, more of that. And we're looking at bringing what we're calling a youth congress, and it's really our youth alum together to really also bring those voices to the community. We just had an event, last week, as I was speaking about, and we had one young person who's in our services right now. And we had another young person, Dylan, who has graduated from our services, but was talking about his journey. And they all have that common theme about just needing to come and really kind of work on where they feel like they are right now and whatever those individual needs are.
Mm-hmm.
And Dylan's writing now, music.
Wow.
He's an incredible artist. He's out in the community and is just doing so wonderful.
That's amazing.
Yeah, we have another young person who's a life coach.
Wow.
She's a mom now, and
wow.
she still comes back and is very connected with Covenant House, but she's really helping to kind of pay it forward and coaching others on their life's journey.
Yep.
So I have huge respect for Guy and all he's doing and how he really stands up for the young people and our community in general.
For sure. And I said this before, but I'll say it again. I really feel like Covenant House is such a great example for how supporting someone can really change someone's life. Nobody wants to be in that position.
Exactly.
And if you're given the supports and the resources that you need, you can turn your life around.
Exactly. Every single young person will say that they never dreamed to be homeless. They never envisioned that, they didn't want to be there.
Yeah.
But we had Gabor Mate and about a year ago, and he talked about the same thing, that it really, at the root of what we're seeing around substance use, and that is really about, what is it that, what was the root, like what caused, a young person to kind of, start on that journey towards that. And that's what we have to get to the heart of. And that takes time, it's not something that happens overnight.
Yeah. Deb, is there anything that I didn't ask you that you wish that I did so you could share it with our listeners?
I can't think of anything. It was really comprehensive. You did. It was wonderful. Great conversation. I would just say that, we appreciate opportunities like this to be able to, again, talk about, the root of the issues, and again, bringing those voices of the young people to the community. And hopefully we can come back again as our strategic plan is underway and continue to discuss. So I'm just grateful to you all and to provide this platform, because it's so important for our community on a variety of topics.
Thank you so much. Well, we were so happy that you finally got to come on the podcast.
Me too.
We've been dying to have you. So
thank you.
Where can people find out more about Covenant House?
So go to our website, and as I said, there are other sites around the world. So it's Covenant House BC is on our website. All of the information's there. And please connect with our team. We'd be happy to if anything I spoke about today is bringing anyone to Covenant House, I'd be happy to speak to them, or we can connect them with the different team members as well. But again, I want to extend huge gratitude to our community, because we couldn't do this without the community that would really wrap their arms around Covenant House over many, many years.
Amazing. Well, Deb, thank you so much for coming on the podcast. It was a pleasure.
Thank you. For me too. Thanks.
Thank you. Thank you for listening to Hey Downtown Van. We really hope you enjoyed today's conversation with Deb Lester. If you'd like to learn more about our organization and all that we do, you can visit our website, dtvan.ca, or you can follow along with the podcast at Hey Downtown Van.